wonder if I could ask us to take a step back and now, as if you're able to put your cap back on as a physician, do you, and this can sort of be what we close up with, but we obviously can just carry on talking forever as well. But the last question I had on my list is whether you see a way in which we can have the best of both worlds. They sound like there's such different ways to approaching the person sitting in front of you. There's such a different way of understanding what it is your job is as a healer. They seem so disparate. I think from what I've heard you say about your own practice that you already are trying to do this, find some way to capture some of this connectedness, this interpersonal relatedness into your Western practice, but that it's obviously context specific, that if you don't have a private room, if you are under extreme stress or pressure, that it's less possible. But I wonder if you could speak to this best of both worlds idea, because obviously there are
Mhm.
also cases in which, as magical as that all sounds, if your patient starts to go into distress or the baby starts to go into distress, I wonder whether there are any number of plants, and this may be my Western skepticism, that can do what modern medicine does, which is,
Mhm.
extremely acute. It's incredibly powerful, and I've witnessed it firsthand. It's
Yeah.
unbelievable what we're able to do nowadays, and we can keep a 24-week-old baby alive, and there's these marvels of Western medicine. So I wonder whether we can agree that there are these incredible benefits to these two approaches, and whether or not there is a way to bridge them. And maybe you're already doing it, and you can speak to that.
Yeah, that was one of the first questions that I started out my anthropology studies with was, I know that this system and I know that system, and I had studied Ayurveda for a few years before I went into anthropology. And my question coming in was, is there a bridge? Or there is a bridge, right? I came in with a statement, there is a bridge, and what does that bridge look like? And by the end of and that question of a bridge actually came up at a recent conference, anthropology conference I was in, where one of the researchers was describing the bridge she found in a Mexican indigenous community living in Mexico, and what that bridge with the healthcare system there was. And I questioned that, not there is no one size fits all, or one indigenous community in one context is not the same as another. But I said, in my experience, that bridge doesn't exist. That bridge doesn't exist simply because of healthcare inequalities, inequities, in how we look to these indigenous systems and what we expect from them. Uh, I definitely don't want to romanticize, the with what I've said of how beautiful that setting was, and that pregnancy, that birth that I witnessed. But that birth that I witnessed was of a woman from that community who had been following with the midwives for months. And in contexts where you have patients that are foreign to that healthcare system, or that indigenous way of being, or the cosmovision that is associated with that type of healthcare practice, I think the expectations can't be as optimistic, right? And this is where modern medicine is really, as you said, life-saving and necessary and irreplaceable in some way. I don't believe that there is any single indigenous system, whether it's the Ayurvedic system or the Quechua system, or that could replace modern medicine, because modern medicine was created as a way to try and fit all after, with all the globalization that's happening, with post-industrial uh, revolution and the way of life that we have in cities, especially whether it's in Austria, Germany, or even Ecuador, right? The healthcare that you expect, or that you need as a person with uh, a busy lifestyle, a working lifestyle, does not meet what a Quechua healer can offer you. Um, in terms of what they require of you as well, because these are systems that really prioritize taking care of oneself. And the concept of taking care of oneself is tremendously different and does not match what we're able to do in cities and with the lives that we have. And so um, not in a pessimistic way at all, but to me, there is no bridge where we can suddenly merge these systems together. However, there is definitely a space for where we can learn from these dying arts of providing care, right? The midwives I worked with and the traditional midwives had attempted to merge with the local healthcare system. And they actually had a grant years ago from the government to open a healthcare center at their midwifery center and have doctors work in that clinic with them. And it ended up being an unsuccessful attempt to merge two systems where they became frontline workers and they were caring for patients 24/7, and doctors would come in for emergencies, but it wasn't equitable at all. They weren't recognized as healthcare workers. They weren't acknowledged in what they were providing, and yet they were providing most of the work. And so I think until that mentality, at least on an administrative, federal uh, level changes, and until we're able to really look at these midwives and see them as equals in healthcare systems and healthcare workers and trust them without understanding what they do, which is the hardest thing, right? Trusting something you don't understand and trusting something that doesn't fit into the algorithms that we've spent 100 years, 150 years now building in modern medicine. Um, is challenging for most, and I'm probably one of the spectrum on the spectrum of very open-minded and very willing to trust, but I see how difficult that is during COVID. For some time during the COVID pandemic, I was with the midwives and I had to trust. I was there as not as a physician, but as a researcher. But when patients came in seeking care for COVID symptoms they had, I had to refrain from giving certain opinions because I didn't understand what they were doing. And sometimes I was quite concerned that this should be a hospital emergency. But that wasn't my place. But I did provide my, ethically, I still had my duty to say this is what I'm saying and this is what I recommend. But ultimately, all their patients survived and actually did well, and they had patients that were referred to them from the hospital. Um, but that aspect of trust, I think, is very hard to come along, especially if you have not experienced that system in a positive way. If you're a physician working in a hospital in Ecuador and you've received patients, and that had happened in the OB in the obstetrics area, that there were patients that would arrive at the midwifery center. They would have been in labor for 3, 4 days at home and then come in when things were already too late or too difficult for them. And they would have negative outcomes, or baby would have negative outcomes. And then the midwives would send them to the hospital, and they'd arrive to the hospital having been re-referred. And the assumption would be that the midwives had done something wrong, or right. And so there's this way of easily blaming. And then as a physician working in a hospital system, if that's what you hear and that's the all the time you have to hear, that's the story you build and the narrative, and that's what your an opinion of the Quechua obstetrics system becomes, and that's really difficult to then surpass, go beyond and build a bridge for, right? It's so it I think there's definitely room to learn to perhaps appreciate what value there is in a healthcare worker's hands, in the ability to know with your hands, and perhaps pursue certain elements of uh, plant medicine. Though I'm often a little nervous saying this because I certainly see that a lot of plant medicine. Um, I mean, historically, there's been abuses to certain traditional systems where we take their knowledge on plant medicine, see what we market of it, and then pharmaceuticals end up with the better end of the stick, and the communities, yeah, and the profits, and so it's a very delicate balance. So yes, there's a lot to still benefit from these dying arts of healing and of care, providing care, but it it would be it wouldn't be much of a bridge really, to be fair and to be realistic.
I think those
But
are all
perhaps I'm
really
wrong.
important. And I think where I see, first of all, I see a glimmer of hope because we've seen how acupuncture and acupressure have been adopted by Western medicine. It's taken them, a couple hundred years to realize, but it's now accepted and paid by your health insurance and seen as a good alternative to pharmaceutical approaches. I think so that there are examples where, given enough of a push, people will identify that 2 or 3 thousand years of success is seen as worthwhile to consider. I wonder if really we have to sort of identify areas where Western medicine is failing, and whether it's, I think there are obviously incredible successes in OBGYN practices, but there are obviously also these gaps where we're seeing, postnatal depression. We're seeing some of the negative side effects beyond sort of the very negative outcomes that can happen. But we're seeing negative side effects that I think would have been or are a ripe opportunity for learning from these cultures in which motherhood is seen as a longer term scale. And I love this idea of, caring for yourself, caring for your baby, both before and after birth, and that you get followed after birth. And I think this is something maybe we do need to think more about. Or I really loved the idea that you said that they would catch or predict something that might be coming up, and I know that in Western medicine, we're starting to try and figure out, are there cues to postnatal depression before the baby's even born? So we want it, but we don't necessarily know how to get it. So
Hmm.
I'm wondering if we can find specific cases in which bridges are more likely. But I think this idea of respect and recognition for these practices without understanding is what's going to be so difficult, because we really want to understand.